Welcome back to Healthwise, and with us is Dr. Carl Gonsolin, pediatric dentist. Doc, also I forgot to mention, I think you're in practice with your sister?
Yes.
Okay, right. Who's also a pediatric dentist. I can't imagine working with my brother,
well,
you know, but I guess, you know, hey.
Oh, we get along fine. I just do what she tells me.
Okay, that's why they get along, right? Okay, Doc, we were talking about all these things now, commercials you see on TV, whitening, the big pushes have the whitest, brightest teeth that you possibly can have. You know, and they have all these products on the market. I'm not sure if it's a good thing for parents to be using this on their kids' teeth nowadays. I mean, maybe you can shed a little light on this, you know?
Sure. I think it's a fad that's going on. I don't think you have to have these perfectly white teeth. It's not warranted on children until they're old enough where the teeth won't damage the teeth. Okay, so if you go too young on the children, in their later teens would be a better time to do it. I don't particularly recommend it unless there's a reason to do it, not just because you want to look better than the kid next door or something like that. The natural color of the teeth is various. You know, it's not a particular one shade of white. It's various, and so if the teeth are clean and they're not damaged in any kind of way, the teeth should look great. You know, they should look very nice, and they should look very normal. Okay, and they're not supposed to be bright white, and you can overdo it. But it's not warranted for the young children, the young teenagers, and the younger kids, of course. Okay, and but the main thing is you keep the teeth clean so they look good. And of course, there are certain situations where you might have a child that has a blemished tooth that needs to be taken care of to fix it up cosmetically and make it look good, and those things can be taken care of. And there are lots of ways of getting that done, and we certainly recommend that when that's needed.
Well, you know, and I guess some people would say, well, stains on the teeth or whatever, but typically a young person shouldn't, I guess, end up with a stained teeth just from day-to-day eating, correct?
That's right.
It shouldn't be, as long as they're using the proper brushing techniques.
Right. You're cleaning with brushing and flossing. When the teeth are clean and they change color without some kind of trauma or something like that, then that's not the tooth that's changing color. That's the surface of the tooth, the plaque on the teeth that's on the teeth, that's taking up the color, showing the color there. Okay, the tooth itself has not changed the color. Okay, it's just been covered with the plaque, and so that's a matter of keeping the teeth properly clean. In most cases, the plaque can be removed, and with brushing and flossing, and 24 hours or so later, it's back again. Okay, so usually one good brushing and flossing a day would take care of most cases. Sometimes it requires more, depending on the individual, what kind of plaque he has, and how fast it grows back, and the diet can influence that as well. So it's kind of geared individually for the need of the child. But if the teeth are clean and they're not internally damaged, they should look very good. If that changes, it's probably a hygiene thing where they need to work on their brushing and flossing properly, so they're actually effective when they're doing it.
Right, and you said earlier preventative maintenance when we talked about it before the show. That's, I guess, your key point. Very important for kids. You know, if they come to the dentist, if they get the checkups, and I'm sure you also teach the proper way to brush.
Absolutely. Good dental health starts with, first of all, getting to the dentist very early before the problems occur. Learning as a parent what you need to know in order to prevent the problems. Getting an initial exam at a year of age, we're more than happy to look at. We don't need to clean the teeth. We can take a quick look and see what's going on, make sure there's nothing going on, and in most cases there isn't anything going on, but we do want to check. Okay, but we want to educate that parent on what they need to know on how to keep those teeth clean, when they need to do it, what diet things they need to know about, because if you keep the teeth clean but you're still feeding them all kinds of junk, you're going to get you still can get problems. and having the regular checkups so that you can maintain that. So if there is something that you aren't able to prevent, you catch it at a very early stage where it's very easy and simple and inexpensive to take care of. So prevention is the real key. The things that most people don't like about going to the dentist is pain and cost. Well, if you don't have the cavities, you don't have to worry about that part, and those two parts. Dentistry is economical if you're preventing the problems as well as easily as you can. And so getting that education is very important to do that, getting good instructions on what to do, and regular checkups to maintain the things. And as they grow older, and they get their permanent teeth in, or they're finished with their baby teeth, they may need orthodontics. Orthodontics is very common. Vast majority of the kids will need some form of orthodontics. But that is something that, you know, that's generally a hereditary type thing, okay? And so that can be taken care of fairly easily. Orthodontics nowadays is fairly simple to compare when I was a kid, you know, and it's much easier on the children to have braces than it was when I was a kid. And so getting that done at the correct age, getting them evaluated at the correct time, and then while they're in braces, make sure they're keeping the teeth clean so you don't end up with cavities while you're wearing the braces. Those things help a lot. Not proper caring of the baby teeth, early loss of baby teeth can cause the permanent teeth to shift, and then that can put them into braces because they lost space, the teeth moved. Or if they were going into braces, it can complicate it by making it much more difficult to end with good results. So it's a win-win situation when you do take care of those baby teeth.
Preventative maintenance, like we said. And you mentioned orthodontics. Y'all don't do that. You do. Well,
we have an orthodontist that works in our practice.
Oh, really?
who takes care of any patient who wants to do their orthodontics with us.
Sure.
And of course, there are many orthodontists around who do a very good job. You know? And we always recommend, on the average child, to see their orthodontist for around age 9 years of age. That's when the 4 front teeth on the top and the bottom have come in. You pretty much know that whatever's there is not going to correct itself if there's a problem. And so the orthodontist can get in at an early age where they can take advantage of the growth and development factors going on, and they can end up with a better result in most cases.
Well, let's back that up. What's the difference, and I mean, you and I know, but for our audience, what's the difference between a dentist and an orthodontist?
Well, a dentist, when someone wants to be dentist, they go to dental school, they graduate as a general dentist, which means they can do anything in dentistry that they're trained to do. That, you know, adults, children, whatever. They can do dentures, they can do bridges and all this, extractions and things like this. They can also do orthodontics, but they're generally not trained to do orthodontics. They can take courses to do orthodontics, but a dentist who doesn't want to do just general dentistry, or he wants to specialize into some particular area of dentistry, can go to additional training and become a specialist. You have oral surgeon specialists, you have periodontal specialists who take care of the gums. You have orthodontists who do straightening of the teeth. So an orthodontist is a general dentist who went to specialty training, usually 2 to 3 year program, and has gotten an extra degree in orthodontics, and he can title himself as an orthodontist. If you're not a specialist, you cannot title yourself as a specialist.
Okay.
Just because that's the law, and that's the truth of it if you're not a specialist. But it doesn't mean that you cannot learn to do these things and do them as a general dentist.
Okay. Okay. Well, Doc, when we come back from this message with our sponsors, we will talk some more about dentistry. And since, like I said, we missed the Dentistry Month, National Dental Health Month, we're going to act like this month is national. We're going to talk a little bit about that.
Very good.
All right.